Hi, I'm a practicing eye care professional, and I'd like to tell you a little bit about the latest scientific information on dry eye, a condition that affects millions of people. Everyone's eyes produce tears. In healthy eyes, these tears help keep the surface of your eyes well lubricated for blinking, maintain a smooth and clear surface, bring nutrients to the eye tissues, and also protect against bacteria, infection, and airborne dirt. In the case of people suffering from dry eye, their tears are not produced in adequate amounts, or their tears do not have the right ingredients and therefore do not work properly. Patients with dry eye may experience dryness, burning, itching, scratchiness, fluctuating or blurred vision, and heightened sensitivity to light. Some patients with dry eye experience excessive tearing because the tear-producing glands are trying to compensate for their eye's abnormal production of tears. If left untreated, chronic dry eye can damage the surface of the eye, interfere with the vision, and limit day-to-day activities such as driving, computer use, and reading. New research has linked dry eye to the activation of the body's immune system on the surface of the eye. This immune response, or inflammation, takes place on the part of the eye responsible for producing tears. Inflammation around the eye can be triggered by a number of other factors, such as environmental conditions, use of certain medications, some surgical procedures, hormonal changes during menopause, autoimmune disorders, contact lens use, and more. When the tissues of the eye become inflamed, this affects tear production. Either the amount of tears is decreased or the quality of tears is poor. As the eye gets drier, it becomes more inflamed and starts into a downward cycle. Increasing dryness causes increased inflammation, which affects the quality and quantity of tears, which in turn leads to more dryness, and so on. In light of the new research on the role of inflammation in dry eye, doctors are now focusing more on getting at the root of the problem by targeting inflammation rather than only managing symptoms with artificial tears. Ask your doctor about treatment options that work differently than artificial tears to help treat the inflammation and break the cycle. By getting the inflammation under control, the irritation will decrease, leading to healthier tear production and long-term symptom relief.